In the early stages of recovery, individual therapy is usually the most important clinical support you can engage in. Working on your personal story, identifying patterns, unpacking trauma, and coping strategies will help lay the foundation for true healing. If weekly sessions aren't feasible, consider meeting with your therapist once a month or every other month with an extended session as a form of maintenance and reflection. When you're working with a CHFP, a certified hope and freedom practitioner, you can engage in intensive therapy, and oftentimes there's more flexibility for the frequency or depth of individual therapy. Couples therapy, on the other hand, should be approached with care in early recovery. When the wounds are fresh, trying to untangle all of the pain in a joint session can often do more harm than good. In addition, clinicians who are trained in marriage therapy but not in betrayal recovery may also unintentionally cause distress or be limited with stuck points, so be cautious about who you enlist to help. However, if you do engage in couples therapy during this time, be sure to use it as a healthy space to manage the current crisis